Thank you to the UNFPA representative. Now the moment that we have all been waiting for has finally arrived. Are we excited? Are we excited? Perfect. Now, without further ado, let me call on Jeanne Umuhire, who will be the moderator for this panel, who will not only introduce us to our distinguished panelists, but will also start us off.
So my name is Jeanne Umuhire, and I'm incredibly stressed, but also happy to be here. In previous years, I was on the other side. I've seen your forum series from the very start to now, and you know, when I was called to be on the other side, I was like, ooh, why me? But I think that I'm actually really excited because even as I work for Team Heart, which is an NGO that with a mission to lead sustainable cardiac care in the country and beyond. So on the other side of the health spectrum, so we know of the infectious diseases such as HIV, and this is the focus of today, but being on the other side on a day-to-day basis, on the communicable diseases side, I'm jealous. I'm jealous about you know, people working in HIV because you have all the funding at the moment. But I also, so this is why I guess my panelists are a little scared because they think I'm going to change them, but I also really join in the cause. I mean, we all know that HIV is still taking a toll on African lives, and we should not, and we will never, you know, diminish our efforts to sort of contribute to the fight against HIV. So without me going more in, you know, about myself, I would like to introduce you our esteemed panelists because they're all actually experts in their field, different fields, but really great at what they do. And I'll start with Dr. Sabin. And if you are in the HIV field, you probably know the name Dr. Sabin Nsanzimana because he's the director of the National HIV program in Rwanda. He has been leading the HIV unit. HIV, it's not actually a unit, it's a division in RBC, the Rwanda Biomedical Center. And he's trained as a medical doctor, but he recently actually obtained his PhD in clinical epidemiology from the University of Basel in Switzerland. So I guess we should, you know, applaud him because that is remarkable. He has over 12 years of experience in HIV, AIDS, TB, and viral hepatitis design, implementation, and clinical research trial. And another impressive fact about Dr. Sabin is that he has published over 100 research articles in peer-reviewed journals and book chapters. Dr. Samba, please join us. And he is also the only male representative on the panel today. Next on our panel is Mrs. Tona Isibo. She works for Global Communities as the Deputy Chief of Party of the USAID Twiyubake program. She's a program management and M&E professional with over 9 years of experience working in the development sector with international NGOs and government institutions. Particularly in the past 6 years, has worked with PEPFAR USAID programs focused on supporting orphans and vulnerable children, HIV/AIDS prevention, and economic strengthening interventions for vulnerable families and youth. In her current role, she's supporting the implementation of the PEPFAR-funded DREAMS intervention in Rwanda. DREAMS aims to reduce rates of HIV infection among adolescent girls and young women across 11 states in sub-Saharan Africa. Tona, please welcome to the panel. She'll be the representative of what in the health field we would like to call partners. Joining us on the panel next is Malise. Excuse me as I sort of, yeah. So Malise is the manager of social health and healthcare at Kasha. Kasha is a private entity. She has experience working for various nonprofit organizations that focus on gender empowerment and women's health. She received her bachelor's degree in international relations and women and gender studies, and an MPH from Boston University. In her current role at KashaRhonda, which is an e-commerce platform designed to improve women and young people's access to health products in a confidential and convenient way, Malise is leading efforts to make the platform accessible to women in low-income communities and oversees the healthcare department. Welcome, Malise. And last but certainly not least, we have Fiel Nabergue. She was actually portrayed on the video, the short video that we just saw. She's the Accelerator program, and she co-founded Umbrella. Fiel is a second-year student at African Leadership University, pursuing a bachelor's degree in international business and trade, and she also works as a front-end developer at DMM Hehe. And as if that was not enough, she's also the co-founder of Umbrella Technologies, which is a social enterprise with the aim of empowering and educating women about their sexual reproductive health. At Umbrella, Fiel is in charge of the project and making sure that operations run smoothly. She's going to sort of be the advocate for the technology industry field, as she has over 4 years of experience working in technology industry. Welcome, Fiel. I guess we may get started with the conversation. And I'll start with Dr. Sabin. Some of you might have guessed, as the representative of the government on the panel today, Dr. Sabin. Don't worry. I'll ask an easy one. And you're definitely going to be, you know best about the program, so I know you have all the answers. So just to put us all on the same page about HIV, we all know about HIV. It's a really bad disease. It's affected many. For the last 20 years, we've heard all about HIV, but we've also heard that HIV's eradication, or at least the fight against HIV in Rwanda, has been a great success in the last 20 years. And most of you in the healthcare field, or even, in other fields, you've heard that Rwanda is actually an example among many countries in Africa on fighting the illness. Dr. Sabin, as the director of the national program, would you please let us know what that journey has been like? How far have we come, and where are we today, especially in terms of the youth and adolescents in terms of HIV?
Thank you, Jean. Good evening. So the journey has been long, but also cool. Seeing the results, achievements happening over time has been another booster to move forward. Maybe you can start with some statistics to just put the history in the context. Like any other country in sub-Saharan Africa, HIV has been a concern, and no one knows exactly when it started. But in 1981, in USA, the first case was described, and 2 years later in Kigali at Seashika, the same case of AIDS was also described. So no one knew exactly where the first case happened. And Rwanda has a unique history. The fact that in 1994, with the genocide against Tutsis, HIV has been benefiting from the chaos and all the tragic history we had. And that puts us in a situation that we had to start far behind other countries to rebuild the health system, but also the HIV program in that has been affected than other groups, as you can imagine. When I started in treatment research for AIDS Center more than a decade ago, I had 800 young people who are just starting treatment, and I was asked to follow them. And myself, I was still in the youth category, but no more, unfortunately. So having been with the young people over the last decade, it gave us some lessons, but also some challenges we've seen, as has been mentioned by the previous speakers. This is the only category of people where more new infections are happening, more death, and resistance to treatment. And it's not only in Rwanda, it's also in other countries in the world, and is a concern. And I hope sometime we will reverse the situation. But there's some good news, especially in the area of PMTCT, prevention of HIV transmission from mother to child. We've seen a significant decline of the infections from mother to children, from 10% to 1% today. And these are the next leaders of this country that will grow without HIV. So some lessons, some challenges, but also some good news. And seeing these innovations and digital platforms, the new tools we have, we are making some good progress. And having this partnership and global solidarity on board is another booster to move forward. So when I meet those young people I started with in track 10 years ago, now they have become parents. They have become leaders. They're taking some actions. It's also another motivation that I would mention as, although they had HIV, but it doesn't stop them to live. It doesn't stop them to contribute to the growth of the country. They are contributing, participating in different ways. So those are good news from the tragic history, from the past, from all the ways we went through. I think, personally, I'm motivated to continue. Sometime soon, we'll have this AIDS ended, and probably tackle other epidemics like we've started now with cancer, with heart diseases and cardiovascular diseases.
Thank you, Dr. Sabin. I'll move on to Tona. From what Dr. Sabin has told us, it almost sounds as though, AIDS has been taken care of. The challenges are there, but they're not that many. Would you be, I know that your programs specifically targeted to young women and girls, but what do you do differently? Is it just enough to talk about AIDS? What is the innovation part that you bring to the field?
Thank you. So Jean said I'm representing the partners, but I think that's because there's so many partners in the field of HIV. And I would say I'm just representing a very small portion of the partners who are working at the community level, implementing OVC programs. OVC stands for Orphans and Vulnerable Children. And OVC programs basically support vulnerable populations, including adolescents and young people, to mitigate the impact of HIV/AIDS. We know that as part of the continuum of response, we need to go beyond just clinical interventions. And this is the sphere in which OVC programs are implemented. So responding more to the economic, social, psychosocial education orphans and vulnerable children and their families, and basically strengthening their capacities so that they're able to mitigate the effect of HIV/AIDS. So in terms of what we are doing as a program, and basically what's happening in the OVC field, so we are not only targeting young girls and women, but we're also targeting broader adolescents. But there are two different programs. So in OVC, we're looking to strengthen families and strengthen their response to the HIV/AIDS epidemic. Some of the ways we're doing this is through education. So we know that education is undisputed as one of the biggest ways to fight the HIV/AIDS epidemic. We know that by completing primary and secondary school, individuals are much more likely to be able to prevent HIV/AIDS. And we know that some of the ways that we know that in Rwanda we have 12-year basic education. So what OVC programs are doing is providing other education support, so providing materials for vulnerable children to make sure they're able to stay in school, but also monitoring attendance to make sure that they're staying in school. Also, economic strengthening is a very important aspect of addressing the HIV/AIDS epidemic. And this is because HIV has a huge impact on the economic stability of families. So by strengthening their capacities through whether it's household grants or financial education, teaching them how to save, etc., you are avoiding the vicious cycle that's created by HIV/AIDS and ensuring that their children will be able to have a better future. On the side of adolescent girls and young women, as you mentioned, there's a program called DREAMS. I was discussing earlier with Dr. Sabe because he was part of the design in Rwanda for the DREAMS program, and now we are on the implementation side, and he was asking me if the DREAMS are coming true. So DREAMS is actually an acronym for Developed, Resilient, Empowered, AIDS-Free, Mentored, and Safe. And DREAMS aims to help aims to address the high incidence of HIV in this population of adolescent girls and young women. So some of the work that's being done revolves around keeping them in school, but also largely providing them with SR/HR education, HIV prevention, and linkage to testing, treatment, and care as required. But also supporting their families through economic strengthening and through parent and caregiver programs to increase their parents' capacities to talk to them about sexual development, about sexual reproductive health and rights, because we know that parents and caregivers can play a critical role in supporting girls to prevent HIV/AIDS.
Great, thank you so much, Tona. So from Dr. Saba, we've heard that the country is putting all the measures in place to sort of fight HIV/AIDS. The challenge is still in the population of youth. As we've heard, it is the only group that is still experiencing a rising incidence as opposed to the other groups. Is that the case indeed, Dr. Saba?
In terms of absolute numbers, yes, it's true. But in terms of trend, new infections are declining in general in Rwanda. So the absolute numbers I was talking about is from a recent study we did at the Rwanda Medical Centre. So we followed over 14,000 people for a year who were HIV negative. Then after 12 months, we retested them again. And out of those 35 who got infected, majority were young people and singles. So, but in general, when you put in proportions, they are not the one that having more infections, but it's a concern. And indeed, as we speak now, every 1 or 2 hours, there's one infection is happening. After this session, we already have someone infected, newly infected. So that's why it's a concern. So, yeah, I concur with what you said. This is a group of people that need to have special attention, and we have already started with special programs.
Great, thank you. So I just wanted to be sure that I painted the picture right. So we have infectious diseases, we have HIV, greatest toll of lives lost, greatest burden of disease in Africa. However, we've been doing great in Rwanda in making sure that we sort of fight against HIV. Numbers have been going down, but the youth is still facing, the largest problem. From organizations such as Tona's, their programs meant to build sustainable care for people that are affected already, and to sort of prevent that, especially in vulnerable populations. So that sort of makes it a very overall, very big picture, sort of problem. But what of, the youth that are just like you and I in the audience? What can we do on a day-to-day basis to participate in the fight against HIV? We can't leave everything to the government. We've been encouraged to to do things on our own, to find our own solutions. And I'm fortunate enough to have Pierre in the audience, in the panelists, to explain to us what that has been like. She was part of the few innovators that thought of doing something. And I would like to know what that was like, and especially since you won the iAccelerator initiative and how far you've come since then.
So we started the program, I think it was starting January 2017. So the concept was finding innovative solutions for young people about sexual reproductive health. And we thought that was as simple as it could get. So we applied and we wrote all the essays, we sent out our application, and after the first selection, we went for an interview, and UNFPA really destroyed us, really. So they really challenged all the concepts that we had, because we were bringing all the technology, but we weren't really thinking about the end user, that young woman who would be using the app, or how they would interact with them, the efficiency exactly. So what I think we learned the best from the whole process, for me, it was the most insightful around sexual reproductive health that I would have gotten really ever. So we got to learn about sexual reproductive health in general, but also we dived a bit deeper. We are not the experts yet, but we really got to understand the subject. We also got training from Inhomoko and K-Lab, so we got to also work on the business side of things, which is also still in progress. But I think our biggest take was that we needed to do better, and we continue building up on that, and we definitely got to know. It was eye-opening for us because we actually learned about sexual reproductive health. It was not this subject that we see on TV and never really care about. It was something that we got to understand and got to care about, and started really thinking about and finding ways to solve it in a way that is great for our target audience, really.
Thank you, Fiel. So we saw in the video that we saw a little bit of what the app might be about. So if I understand well, you get information on how your menstrual cycle is and about reproductive health in general. But to me, it sounds like this is an app for women. Is that the case? So can men also look at it?
This is just like in a business model canvas, really. I'm just citing what we did. So we are mainly targeting women, young women between the ages of 16 to 30, really. And so the men, they can maybe read the articles. That's extra information for you guys. But you only to track your cycles, but the app really is to empower women and girls to learn about sexual reproductive health and make informed decisions in their lives, so really so that they can fulfill their potentials. So the men, please read the articles.
Sophia, thank you. I mean, I won't bug you any further on that, but it's actually food for thought for everyone here. Is reproductive health a women's issue? Should a husband know when their partner, or just a partner know when their partner has, is ovulating or not? I think this is really food for thought for the way forward and how we should be tackling family planning in general. But I'll let it be I won't bother you anymore on that field. Now moving on to Malise. I know Malise is excited because she has a lot to say. She has interesting things to say. And I'm actually interested in what she had to say. Malise works for Kasha, but she can tell us more on how that works and the products that they have and how they think they're going to revolutionize the field, actually.
Thank you, Jeanne. no pressure. So I'm with KashaRhonda, and as Jean mentioned, it's a new approach that we have here as a private company to address some of the challenges that youth and also young women. Oh, sorry. Can everyone hear me better now? Okay. So we are with, I'm with KashaRhonda, and we are a private company trying to improve access to, oh, thank you. This is going to be better. So KashaRhonda is an e-commerce platform that was designed for women as well as young people, where among other products, it is possible to purchase contraceptives in a confidential, delivered to the customer's location of choice. So we say that we are offline and online because a person can access our platform by either visiting our website or downloading our Android application and placing the order online. However, we know that not everyone has access to internet. Therefore, even if you just have a simple phone, there is a short code that you can dial, and you're able to place your order confidentially. So in terms of the range of products that we have, specifically in relation to contraceptives, we have daily pills that women take every day. We have emergency contraceptives. We also have condoms, and also long-acting methods, which are injections or implants. And for all of us healthcare experts or professionals here, for the injections and implants, we don't send them to the customer, but we connect them with health partners that will do the injection or the implant in a confidential and convenient way. More in relation to the discussion that we are having today, we have started collaborating with Project San Francisco since February 2018 in the distribution of HIV self-test kits using our platform. And the way we do it is they are distributed for free and added to orders of condoms or emergency contraceptives or pregnancy tests. And when I say add, it is not mandatory. So it means if you are our customer and you request those products, we don't send the test and it comes as a surprise. We do ask you ahead of time if you're interested in having this product added to your order. And there's a reason we offer it to someone who is ordering, for example, an emergency contraceptive. We know that you are sexually active, and so this product is more relevant to you, and you belong to a group. It is recommended that you check in with your status, whether it's HIV or other sexually transmitted infections. So in getting feedback from our customers, what they enjoy or appreciate in using our platform is that it's confidential. When you're ordering here, you could be placing the order right now to Kasha and no one is aware. You don't have to walk in, let's say if you needed to go into a pharmacy and place the order. And that speaks to our mission as well, because what we want to do, when we think about contraceptives or even the HIV self-oral test kit, it can be very intimidating for a lot of people to walk into a pharmacy or even a health clinic if it's offered for free. I'm even willing to bet that some of us cannot do it in this room. So having other channels of distributing these products, thinking about who is, if we're talking about young people, is the most comfortable experience walking into the pharmacy, is the most comfortable experience going to a health clinic where there might be people that know me. And so that's what we have really been trying to do, where we leverage technology to bypass, when possible, the tradition of face-to-face interaction that is required in getting products that are often stigmatized and not easy to access in person. So we have been able to distribute over 400 HIV self-test kits. We're continuing to do that. And we've delivered over 12,000 orders in Kigali. We have just expanded to Huye as well. We just opened an office there. And we're also, since February 2018, in Kenya. So work in progress, but we can bypass traditional.
Thank you, Maliz. I have more questions, but I think that, for everyone's sake, it would be best to sort of already have a few questions come from the audience to see if you already see one. Okay. I think that I'm biased. I'm going to actually let the DG of RBC ask the first question.
So much, Jean. Thank you, panelists. I'm learning a lot. Actually, we should do this a lot. You know, Malise, you said something that is actually trying to work on because adolescents, as Dr. is our key as well. As he said, HIV is not only the most disease that is affecting this group, but also we are seeing malaria, you know, simple like malaria and others. I think it's interesting to see the profiling of your clients without names, confidentiality. It would be good to know that so that we see who is the type of the customer you have. Can you extend it to the rural population? Can you extend it to students? Can you extend, you know? So it's good to know that in general, so that I think policies can be based on the facts that you have. So I think this is really exciting, and it's something that we can learn from you, and move forward and changing the policies that we put in place that is tackling and targeting the adolescents. Thank you so much.
Magnifique, Yakoza are my names, and I'm going to direct my question to the representative of RBC. I'm a doctor by profession, so I know actually about HIV, and I know what the steps the government is doing. They are quite amazing. But I have a question. We have not been able to shake the 3% prevalence of HIV in Rwanda for almost a decade. So I'm asking myself, how are we going to move that, you know? It's been there. It's a world that I feel like we should hit it and go beyond. So please shed some light on that. How can we move forward and make sure we are no longer the 3% prevalence, probably 2, 1, or even 0? Thank you.
So, thank you for the question. I would also want to encourage, if in the audience there's anyone living with HIV, to share the testimony. We need to hear the patient group, the advocacy side, to know what to do better as policymakers or partners. Or anyone who has interacted with a person living with HIV.
My name is Viateur Muragijirema, and I work for Kigali Hope. Kigali Hope is a local NGO working with young people living with HIV. I have a question for Mr. Sabe, Dr. Sabe, I'm sorry. We recognize that there is a quite big number of young people living with HIV in Rwanda. And there's also a big number who are still at boarding school, in secondary school. At boarding school, there is a problem of taking ART, the antiretroviral treatment, because of stigma and discrimination at school. They fear their friends at school, and they don't take ARV in school when they're at school. What do you plan to address that issue? Thank you so much.
Thank you very much. I think it would be best to sort of answer those questions now and then go, if we have more time, go for the next round of questions. I believe that Dr. Sabin, you've been asked questions, and Malise, maybe a comment to respond to Dr. Kondo.
Sure. So in terms of the profiles of our customer, we serve students, and of course, again, everything is done confidentially, but based on the location, we can know who we are serving. So we work with high school as well as university students. They're part of our customer reach. We also serve professional women living primarily in the urban areas, and we also serve women living in low-income communities through an agent network, because we also understand that if you're trying to reach what in business is called bottom of the pyramid customers, not even everyone has access to a phone. So the women that we train to be our agent go into the low-income communities and are able to talk about Kasha and the platform, and also help women in their community use it. So really we serve a range of customers for high to middle to low-income women. So far we are primarily in Kigali, but as I've said, we've also started operating in Huye, and the idea is to be able to continue to have the platform available in other areas. But it's a mix of young people and I guess adults or older people. And it might be that younger people are around 40% of our customer reach. Thank you.
I think maybe a quick comment on Malizi's presentation. We are very interested to explore that, and you have been planning that in RBC with our e-learning platform, where not only people can order products online, but also can learn how to use those products online. So this is an interesting idea. I think tomorrow we can meet and explore more. So on the question of 3%, maybe I'll explain how we measure this 3%. And I don't expect this number to reduce now or next year because of what I'm going to explain. So this is a prevalence number that we measure out of a sample population, including HIV positive, including HIV negative people. Then we sample households. Then we measure those who have HIV. Majority of those who are considered 3% are already HIV infected and are part of our program. So we don't want to lose them. They need to live longer on treatment. That's why this number remained flat, because those who have been infected are still in the program, and they will stay in the program. And indeed, we measure the life expectancy of people living with HIV in Rwanda, and it's similar to those who are not infected if they start treatment before the immunity goes below 500 CD4, which is a level of immunity defense of the body. So, however, the aging is shifting to the right. We see the peak of infections moving towards the people who are 50 years old, 60 years old, and probably in the next 5 years or 10 years, we'll see the prevalence going down maybe to 1%, because the younger people are, as I said before, those who are below 15 years, the prevalence is really low, below 1%. So those ones will get older at the age of 50, as the other ones have already moved to 90 or 100. So in that time, our measurement of prevalence will not capture those ones, and the prevalence will reduce. But as of now, if the prevalence reduces, it's a problem. The death will have increased. Second question on ART in schools. I think we know the issue since like 5 years ago, and some actions have been made with the new model of giving patients drugs for longer period. Because even before, schools were not allowing children or students to go out and pick medicine. So we decided to give them like 3 months stock. They can keep their stock for 3 months, but also educating the school heads on to create an environment that helps the students to take their medications in full confidentiality mode. So we know it's still an issue, but as the simplification of treatment also happens, we hope it will be as we speak about innovations and digital and research bringing new ideas. I think you've heard that this new research of injectable drugs that are being studied have been presented recently, and soon in International AIDS Society in Amsterdam in July will be again presented results. Interesting, where someone gets injection for 3 months or 6 months instead of taking pills, then you can remain on treatment just because of that injection. Another research being conducted on long-acting antiretrovirals. It's still in the research development. It's a pill you swallow, then it remains in the stomach, then it can release doses on a daily or weekly basis for 6 months or 1 year. Those are new developments that we are following closely. Probably we'll be solving this issue long term. But otherwise, we'll continue to work with schools to facilitate those students who have issues of confidentiality with their medicine. Yeah. Thank you.
Thank you very much, Dr. Saba. So it sounds as though in terms of suppressing and treating and managing HIV, we have solutions. But what of knowing our status? Elise mentioned that there's the issue of the confidentiality, sort of, not everyone is comfortable just walking in a pharmacy and buying an after pill, emergency pill, Plan B, but they provided the solution. As I open the floor and have the audience ask more questions, I want us to be thinking of, perhaps I could go on the app and purchase whatever I need, but what of the person in a very remote area that, one, does not have a smartphone, two, maybe does not even know how to read? What is left for them? I just want us to think about that, but I'll let DG. Yeah.
Thank you, Jeanne. My question goes to Madiz. Yes. In my time, it was important before doing a test, HIV test, to have a counseling, because you can have some, depending on your results. So at Kasha, how is it done, the counseling? Is it still on, or for young people, it's not important? Thank you.
Okay, I have a quick question based on your comment, because I think it's very important. I think the information got lost. The fact that one of the things that struck me in the program was that Tubigani, the TV show, that brings in a setting of parents who are talking to the kids about sexual reproductive health, which is not the reality in Rwandan families, right? And that's why we have a growing prevalence of adolescent girls who are becoming HIV positive. And so I think we have to discuss for every program that's related to families, how do you change mindset so that parents are having these conversations with young people, which helps the interventions that come later, not to put Kasha out of business, but if you are catching it early, you're able to put Kasha out of business, because you don't need anonymized programs even if they continue. I mean, the fact that our young people have to rely on an anonymous platform is really a problem. And so what are we doing as a community, as a country, to not just treat, to not just have programs that capture the vulnerable people, but also have parents or those of us who are parents now, how do we go forward? Maybe not our parents, because that's never going to happen, but maybe young parents, how do we get them to talk to their children? Because that is a factor that's missing in this conversation.
Thank you so much. That is indeed something that was lost in the conversation. And I'm not sure if there's a representative of the family. I know that the Minister of Youth is in the audience. Yes, yeah. So I would like for you to please maybe address this concern, but also touching on, I know I'm giving you a lot of responsibility, but also touching on schools. We do not have the conversation in families. We do not have it, as far as I recall, I did not have it at my school in Rwanda. What are policymakers thinking?
Thank you very much. I really want to appreciate what the young people are doing. Like my colleagues mentioned, I'm also learning a lot from you. And I didn't know this much is happening in the field. I was caught off guard, but I'm ready for the intervention that you asked, because I'm representing the colleagues not here. The question that you raised is very pertinent, and that's why even the scourge is increasing, like they said, especially among the young people. Because as a culture, normally it's like a taboo. That's the past. They used not to talk about the sexual reproductive health in public. It would be something that would be discussed in secret discussions where girls speak to their aunties, and that kind of the dynamics are changing completely, and that's why the discussion now has to come open and discuss this. Because the social media, the media out there will provide the information that the parent is not doing. So parents are taking the responsibility of their children at schools at the same time. And this is what we are encouraging mostly, that parents, we should take responsibility of our children, and we discuss about all this. First of all, you have to be a friend of your child so that they are free discussion, these free discussions. And there is no, I think I saw it in the movie, or the Tugani, the one which to be garnered. Yeah, that I think we need this coming, especially from the young people that would air out on TV and the radios, so that it can open up. We have various partners in this program. We are doing radio in the rural areas where they discuss about this, and girls speak to girls. But also, we don't want to find this as a girl issue or women issue. It's general. It's for men, it's for boys, it's for girls, it's for women. So it's for all of us, because it's like you're telling your girl to take care, but the boys, you're free. You move on and do all this without any control. So it's also sexual education, sex education should be for both girls and boys. If it's about contraceptive, it's about condom usage, all of them should know how to use them. So as government, what we are doing is creating more awareness, but using partners that we have on board. And we've got some new partners on board today that we will be engaging in the near future. So it's a program that we really want to consider working on, so that we reduce on prevalence and also increase of infectious diseases on young people. Thank you.
Thank you so
Jean,
much.
if I can add to that, there's no one from Migeprof here, I think, but we recently worked with Migeprof on developing a positive parenting manual to be used mostly at the community level in rural areas. And some of the platforms that will be used to deliver this positive parenting education is existing government platforms like the Umugoroba w'Ababyeyi. And this positive parenting covers all age ranges, and recognizing that at different ages, parents need to be able to talk to their children and engage their children in different discussions. So I think maybe that might be something that helps address this issue in the long term.
Thank you so much, Tina. Looks like we have maybe 2 more burning questions, and then we'll move back to focus on the panel.
Thanks a lot. My name is Michaela Rogwizangoga, and I was involved with the project, the Accelerator project, until very recent. Being part of the team that coached the young startups, my question goes to Pierre. Where do you see Umbrella in the next 5 years, in the next 10 years? Today it's an app. I know that there is a community of women who are using your app, but what's the future for your business? Where is it going? Thanks.
Thanks, Michaela. I think it's a difficult question to answer right now, 5 to 10 years, but our vision is to really provide the information directly through the less mediums as possible. So for now, we're working on the app. After, we want to include in more information about different services that are available and that women should take advantage of. So that's I think the next step for us, and also launching the app to the public. So we really want to be the go-to platform or social enterprise for women to learn about their sexual reproductive health, not only through digital, through technology, but also through different programs that can help them evolve. So the goal is to give them the information as fast as possible in the most convenient way for them, by also giving them access to the right information. So a mother won't miss out on a program about that they should know about when they are pregnant, or a girl. So they really making sure they know all the available things they can take advantage of, and also helping in the creation of different opportunities for these women to improve and evolve in life.
Thank you so much, Fiel. So since we went back to the panel, I want us to maybe finish answering unanswered questions. One question went to Malise, and coming from Leger. Thinking or speaking about confidentiality, but also in general. So we're doing great. We're using technology to tackle health issues, HIV/AIDS in particular. However, that sort of leaves healthcare workers to not being part of the solution. So what do you do to connect your customers in general, not only in terms of confidentiality, but also follow-up care? For example, if we were to take...
Hi, Jean. Everything's going well? So sorry to interrupt you. But before you continue, on behalf of Imbuto, we do have a little intervention we'd like to make about our PAC forums, which stand for Parent and Adolescent Communication Forums, and maybe Amanda can highlight that.
Thank you, Casey. As Casey said, we're actually answering the communication between parents and adolescents. So we have these sessions that take place as 2 sessions, where we gather parents and their children to bring out why exactly they don't talk about sexual and reproductive health. And in the first session, they highlight the reasons why they don't talk about this topic. And most of the times, parents highlight reasons as to, most of the times related to their job, they're busy being in the field and so on. And children blame it on the parents, also not having time and making that first step. So after the 2 sessions, you find out that the discussion has actually started in the family, and this is really working where we're doing this. So we're actually working also with the Minister of Gender and Family Promotion, and we developed a guide for parents that, because most of them had expressed that they don't know where to start when they start talking about this subject. And we developed this guide that is available to be printed out by different organizations, and we're about to disseminate it in different sectors and districts. So everyone is free to check it also on our website, where we have the soft copy of that guide. And yeah, we just wanted to highlight that some organizations have started to find solution to that problem. Thank you.
Thank you so much, Amanda. So maybe Malise, and also this will be sort of your closing remark, if you may address the question of your solution, the digital solution, giving more liberty for the customers to be in charge of their own health, but also making sure that we do not leave healthcare providers behind, because that's what they do, that they're there to make sure that we're healthy. How do you link the two?
So in addressing your question, we do offer counseling. When you receive the HIV self-test kit, it comes with instructions, first in 3 different languages to help you to use it. But also there is a toll-free number operated by Project San Francisco, who is a health partner. And a customer can call that number if they have questions about first even using the test, if they don't understand the instructions, but also whatever results they may find, whether they're positive or negative, they have a support mechanism, and they usually connect them to other healthcare providers. And we understand we are a private company, and that's why we worked with health partners to deliver that health information aspect. Actually, even for all of our products, the ones that need prescription, we do make sure that the customers provide the prescription. It's great what you can do with technology, because you can even send an image via WhatsApp. So there's still other ways to prevent, maybe not that face-to-face interaction, but there's counseling and health information that comes with the pharmaceutical products that we deliver. I know that for each time there's a package that goes, we also have a phone number of the pharmacy that we work with, in case it's not just about the HIV, we're also distributing other healthcare products. And then I'm also combining it, interestingly, with the comment that was made about Kasha going out of business. Actually, we do welcome that day where it's not confidential. It's not required for me to say, I want to test myself and I have to use Kasha. In that, when that day comes, you use Kasha because it's just convenient, because I don't have to leave my home and I can refill my daily pills without having to walk in, but it's not confidential. So we welcome all of our partners that are doing something to start that conversation and get people to be more comfortable ordering these products, whether online or in person. Thank you.
Yes, sure, Dr. Saba. Yeah.
On the issue of counseling, we've seen a lot of transformations in the past 3 years. As the face of HIV changed over time with treatments, with people living healthier, and also new infections decreasing some time. The counseling has been updated. So we changed from 3 sessions that were taking people forever at the clinics to come and speak. Even people not following what you say, they know exactly from the first day. So the changes were in the line of simplifying the care and support we are giving to patients. So this self-testing initiative that has been already adopted as in the national policy, and Kasha is just helping as a tool to reach people, but nationwide, the counseling sessions have been simplified in a simplified tool that is in the kit. When you receive a self-test kit, there's a key information for counseling. Then there's a phone you can call, you can ask, and this has been tested in several countries, and evidence shows that actually keeping someone long in unnecessary counseling is more traumatizing than just saying, okay, you have HIV, A, B, C, D, you should live healthier, this is treatment, and it works. Maybe representative of people living HIV may speak better. LLP Police is represented here. If we have time, they may share their experience. Thank you.
Yeah, I think this works. Just so we're a little behind schedule, so we can make sure we respect our organizers' schedule. I would like to ask our panelists to give closing remarks, but make it 3 words maximum. And I want you to use those 3 words to describe what the future of healthcare, of HIV/AIDS for adolescents will look like in 2 years.
2 years?
Oh, sorry.
So it will be in 2020. Just say.
1, HIV is becoming a chronic disease, a disease of wellness for everyone, including youth. 2, there is a hope of treatment that cure HIV maybe in the next 5 or 10 years. But don't ask me if it doesn't happen, but there's a lot of evidence about that. 3rd, beyond HIV, there are several challenges that are actually complicating HIV management. Those are comorbidities. And last, with these new technologies, with biomedical services, we can be the first country to end AIDS in the world, starting with young people.
So I think there's no silver bullets in addressing HIV/AIDS in adolescents, but I think there's an expanded evidence base that shows us what works. I think the Rwanda government and the national HIV response is doing a lot in that framework. We're also operating in a declining donor budget, so we need to address that as well. But I think moving forward, continued strengthening of SRHR, education, and making sure that we're linking those who are affected to treatment and care.
Thank you. Since I think no one did 3 words, so I have 3 bullet points. And I think for me, it's hopefully that it's not stigmatized anymore, whether it's for young people or adults who have HIV/AIDS, that there is an easier access to treatment, and also in people who are interested in testing themselves and know where they stand. And the 3rd point, I think also speak to what you said, hopefully lower than 3%, or what Pacific said. So I hope that we're seeing that decrease.
So I will do very short sentences. It's slow. I'll do the three words. So I will say first, a learned youth, so who really know about sexual reproductive health, and also ownership about sexual reproductive health and growth. That means the youth succeeding in whatever endeavors they take on. Thank you.
Well, thank you, panelists. Did not respect the 3 words, but that's okay. I would like to thank Imbuto Foundation for organizing this panel and for trusting the panels and myself for leading you through this conversation. And maybe in closing, what I can say is that even though I started off saying that I wished the global funding money was more going to communicable diseases, but it looks like it might actually be feasible because we're taking care of the problem with our own solutions. We're already moving into the sustainable phase of things by bringing in tools that are sustainable. If we're all contributing in a little bit, building our own apps, paying for our own solutions, then we're definitely touching the sustainable solution path. But meanwhile, as Dr. Sabin said, the youth is still burdened by HIV/AIDS. So we still need everyone involved. We still need the local institutions. We still need the government. We still need partners. We still need youth. We still need ministries, all ministries. We need the health. We need the education, the youth, the family. But I think that if we're all in this together, we'll definitely get to where we want to be in 2020, maybe, or 2030, which is 1990. Thank you all, but before I hand over the mic back to the MC, someone from Gambia has requested to give short remarks as well.
Hello everyone, my name is Nafisa Tambajang from the Gambia. The theme this year is accelerating Africa's single digital market. And one thing I felt that was missing from today is you guys talking about reaching out to other African countries. I know that you mentioned you have your app in Kenya, which is great, but you have other countries in Africa that don't have access to the technology, even though we did trainings grassroots-wise. So do you guys have plans, all of you on the panel, on traveling, if you're going to travel, train, or be hosted by a country and share some of your ideas with the world? Because right now I'm looking at Rwanda like you guys are the real Wakanda. So, so please share with us.
All right, so it sounds like we just got 5 free invitations to Gambia to share our experiences. Thank you so much, everyone. I invite any of you that might have follow-up questions to address them directly to the panelists. Thank you.